The classic clinical manifestations of HFRS is fever, hemorrhage, and renal failure. The incubation period usually lasts for 14 days, with a range of 7 to 46 days. During this time period, the virus is replicating within the polymorphonuclear leukocytes, or PMNs, of the immune system. With escalating viremia, nonspecific systemic signs and symptoms such as fever, severe headache, myalgias, arthralgias, and low back pain occur. Early HFRS is also associated with a flushed, mildly edematous face with hyperemia of the upper part of the trunk, scleral and conjunctival injection, retinal hemorrhage, petechiae, and ecchymosis. In certain patients, the pathognomonic sign of HFRS, vision changes described as, quote, fog when looking at close objects due to retinal hemorrhage, may be present. As the disease progresses, fevers begin to abate, while acute renal failure and hemorrhagic manifestations become more pronounced as the virus attacks platelets and the endothelium of blood vessels. These manifestations include cutaneous, scleral, and conjunctival hemorrhage, epistaxis, gastrointestinal and uterine bleeding, cerebral and subarachnoid hemorrhage, and adrenal gland hemorrhage. In severe forms of HFRS, disseminated intravascular coagulopathy, or DIC, anuric renal failure, renal capsule rupture, multi-organ dysfunction, shock, and death may occur in up to 15% of all cases. For those who survive, convalescence begins during the 3rd to 4th week of the disease process, but full recovery does not typically occur until 3 to 6 months.